Thank you, Vincent. Thank you, everybody, for being here today. As Vincent alluded to, yes, rather dominant in the telephony space, serving over 3,500 GP surgeries. What we're going to do in the next 9.5 minutes, I think if they allow us, the 10 we'll push through, is just to step back and look at, allow you guys the time to reflect on your digital infrastructure or your ecosystem within your surgeries. And following on from Vipin's actually really well-formatted speed debating, we'll lean into some of that because we touched on some really poignant subjects around digital transformation fatigue. And hopefully what we will go through over the next 8 minutes, and as you reflect on the products and services you're using within your surgery, is could you make it easier for your staff, for your patients, whether it's looking at the data that's used, how they're accessing services, how you're navigating around your GP surgery and into specific services in the community. So we started off, I always start and preface my talks to say that I'm a digital transformation consultant by trade. So I worked in digital transformation for 5 years before joining Exxon Health, working with GP surgeries, primary care networks, what were CCGs, ICBs, to evaluate digital tech stacks. Okay, that's really how we've branded it. So over the next 8 minutes, we're going to go through each part of this 5-step segment to look at how are patients accessing your services, how do you navigate those patients, what happens in the consulting room. We'll talk a little bit about AVT there and the ambient voice technologies that we've already touched on and is making up a large portion of the conversations out in the dinner hall as well. Then we want to review communication methods. How are you communicating with your patients? Is it effective? Is it a burden? Are you coding it? How are we operating there? And what are you doing to improve that flow? Again, and again, I don't want to steer you towards looking at data. We talked a lot about data earlier, but it may not be data that you're looking at. It may be the ways that you collate feedback. Are you using friends and family testing? Do you use the GP patient survey data? Or have you built an in-house data platform where you're reviewing all of this anyway? So I want to just walk through that as well. And I don't want to shy away from it. At the center of everything we do is the patient or the citizen as we start to think about neighborhood working. So a typical GP practice might have a different solution for their access point, the way they navigate, what they do within the consultations, how they communicate, and then how they improve that. And as I said, at the middle of that typically is the patient or the citizen. Onto that, and as we look at the data, what actually could be at the center of that is also the clinical system. Because if we think of population health management, large portion of next year's funding will be based on the health of our population today and how do we improve that. We talked a lot about, I think, Gernak made some points about digital transformation and whether they're measurable or not. So we need that data to be feeding into it. The only way we do that at a regional or national level is if the data is in the clinical system. So the first segment is access. And so I should point out, you should have, we're going very analog, sticking with Vipin's format, is on your tables you should have a leaflet that is an Exxon Health leaflet. You should also have with it a pen. So as we go through each of these slides, we're going to touch on those 5 segments. And I just want you to write down the suppliers that you're using at the moment within your surgery. If you're within a PCN, you could write multiple suppliers if you do have that fragment. And again, if you're at an ICB level, just put down the suppliers that you're using across your region. So access is the front door, okay, whether it's voice, web, walk-in, or an app. And I want you to write down the telephony supplier you're currently using within your surgery. Then I want you to think about other methods of access, maybe via a voice agent. And then what I want you to do is write down the supplier you're using for your clinical request or your medical request to come in. If you've got a different solution that patients submit their admin requests, please write that down as well. And then I want you just to look at the supplier that you're using and look at these key questions. Is it equitable regardless of the patient's need? And I'm not just talking about patients with disabilities. I'm talking about patients with temporary inabilities. Okay, we all have temporary inabilities at times. If I wear glasses during the day and I take them off before I go to bed, I'm temporarily visually impaired. If I'm in a busy bar in the airport and I'm looking at the TV, I might be able to hear, but I can also hear a cacophony of sound. So the subtitles will help me. So we need to start thinking about our digital solutions that are supporting these edge cases, if you like, because we can serve the masses. Because as I said, if I'm driving in the car, I may not be able to use my online consultation platform, but I could call the surgery and use my hands-free kit. Doesn't mean I've got a disability, I've got a temporary inability. So as we look at these digital solutions and how patients access it, I just want that to be front and center of your mind. The next segment, I want you to type down any way that you navigate patients. And what we typically see in general practice is that the demand is already coming in, and we're using our human resource or our staff to navigate those patients away, typically resulting in a text back to the patient or calling the patient back. So if you are using care coordinators at the moment that are doing that, just jot that down. If you have got a software in place or a digital supplier, just note that down. And this is, whether you've got staff doing it or you've got a technology doing it, there's data there. There's training data, there's a flow, there's a pathway that your staff are going to follow. Could you use technology to follow that pathway as well? So if you are, I'd like you to write that down as well. I've started talking a little bit about the porch to the front door as well, and just in brackets to highlight it there, it's before they knock on the front door, how will they know they are at the right house? We talk a lot about the digital front door. We talk a lot about the demand coming into general practice. And we'll talk about this in the improvement segment later, if you look at the data, how much of those requests that are coming in are your staff just signposting back out? Could we automate that? So if you do have an automated digital solution that is your porch, acts as your porch in front of your GP surgery and your staff, just jot that down as well. And here at the bottom, I just want to put a key insight, is navigation is where I think AI earns its keep. Okay, it's very safe, it's easy to deploy. You've already done all of the work in terms of designing the pathways, just digitize them, and you can save yourselves a lot of time. The next one is consult. Just conscious of time, so forgive the clicking. The consultation, this is where the clinical consultation has happened between patient and doctor. What are you using that to transcribe that conversation, and have you thought about every modality? It's not just about patients in the room. We've got patients on the phone. We've got patients on video calls. Which technology are you currently using to transcribe those consultations, summarize them, and typically code them and file them back? And that's a key question, isn't it? Is your AVT filing back to the record? Lastly, I've put this on one slide for expediency. The fourth segment is communicate. So how do you communicate back to your patients? Which SMS provider you're using? Do you have the ability and control to send out one unique link? Do your admin team or secretaries have the opportunity to send out bulk invites? And are they coded, and how are they operating within your surgery? And then lastly is the improvement segment. So I really would love to understand what you're using to analyze all of the data that you're collating between those systems. So as you look down at your paper now, and you look at those different suppliers that you're using, how are you tracking all of the data and the patient pathways between those? Because the only way you're going to improve that is by understanding that and measuring it. So what I'm trying to get to is that all I want you guys to do, and I think that across the country, certainly across the United Kingdom, is look at the fragmented systems that we're currently operating, not just within our GP surgeries, but across PCNs. Lots of work has been done to kind of remove or reduce that mixed economy, because it's very difficult to track the data. What we're now leaning into is how do we optimize it? How do we make it more joined up? And this may be collaboration between suppliers. And I had a very interesting conversation last night around some of the teams across Modality that are doing that, and they are optimizing and they're joining up their suppliers. But there is a simpler way, and one thing I wanted to end on is, yes, Vincent opened with saying we have a large portion of the market that are telephony, which is Surgery Connect. There's other things that we're now building into our platform. So the voice agents, the automated navigation, we can now do within the Exon Health platform. If we look at consultations, we've partnered with Tortoise for pure reason. It's science-backed, evidence-based, ran the largest AI pilot with Guy's and St Thomas's, and we've integrated Tortoise directly into your phone bar. So again, it's integrated. We want to track the data points through access, navigation, consultation. Last month, we announced also that we are doing appointment reminders. So from your phone bar, you can now communicate back to patients. Single appointment invitations, bulk appointment invitations, all coded, declines being coded, all in one place. And then we look at the data. Some of you in the room, I know that I've been speaking to, are using Surgery Insights, and it's very quickly become, I love AI, I love access, I love all of the outcomes that we get when we automate navigation and allow and improve access. But really, my favorite product within Exon Health at the moment is Surgery Insights. And that's a one-stop shop data platform for all of your data, not just spanning our technologies, but every technology that you'll be using within your service. And lastly, I did want to touch on, it's not all about digital. What we also need is optimization of these products. Whether they're products or features, they need to be optimized. So our largest team within the business, Exon Health, you may think, oh, look at what they're developing, it must be development. Look at what they're designing, it must be product. No, it's actually our customer success team. So our customer success team will schedule account reviews and sit with a member of your team every single month. They'll run through our academy, which I haven't got a slide on, but we've also got supporting materials and online knowledge base for you to work through with your teams to make sure that we're deploying in the right way. We don't have that fatigue of forever changing digital technologies. And to me, that's the most important part. So when I go back to a digital transformation consultant by trade, that's what we're leaning into at Exxon Health. All of these solutions are available in the market with 10 different suppliers in every segment, or 10 or more. But it's really how do you make them joined up to make sure that you're not only delivering the impact to your staff, the benefits to your patients, but how you're analysing it and improving it every single time. Thank you.